Good evening, everyone. My name is Tyson Pankey, and I'm a member of the Society of Teachers of Family Medicine. Today's webinar is a result of STFM's Underrepresented in Medicine initiative, which aims to increase visibility of those underrepresented in medicine. This webinar is a part of a series of efforts that's led by our group within the Underrepresented in Medicine initiative, whose goal is to increase the number of underrepresented in family medicine who are engaged in scholarly activities. Please know that this group holds regular Twitter chats, webinars, and workshops related to promoting scholarship in family medicine. If you're on Twitter, please feel free to use the hashtag URIFM, that's URIFM, and share any insights with us. Thank you again for joining us this evening. We really hope that you take many learning points away from today's webinar. And before we get started, a few housekeeping things to keep in mind. Number one, our webinar will be recorded, and you'll be able to find this recording on STFM's YouTube channel in just a couple days once it's uploaded. And we'll also send an email to all of tonight's registrants with a PDF version of the webinar. So without further ado, I'm happy to introduce Dr. Pasarica, who will be sharing with us her presentation entitled Writing Clinical Case Reports for Publication, URM Scholarship Series.
Hi, thank you all for being here. We appreciate it. I know for some of you it's a little late. For some of you it'd be just after work, so I appreciate your commitment to scholarship. We are gonna do this as a kind of beginner's guide to writing clinical case reports in an effort to increase the scholarly output from what we do every day as physicians. My name is Magdalena Pasarica. I'm Associate Professor of Medicine at UCF College of Medicine in Orlando. My experience, just so you know how it's relevant to this particular talk, I am the Associate Editor for International Journal of Obesity. I'm the co-editor for the STFM Education column, which I strongly suggest you submit to. I'm the co-editor and founder of the flagship Scholarly Medical Proceedings, a PubMed indexed medical journal, and I'm the guest editor for Florida Academy of Family Physician Journal. So as you can see, due to my research experience, my PhD and MD, I was able to do a lot of scholarship, and I am happy to share with you what I have learned throughout this journey in regards to clinical case reports. So the objectives for the sessions, you should be able by the end of the session to discuss the importance of publishing case reports. You should be able to select a case to submit for publication when you see one. You should be able to write a clinical case report and submit it for publication. So these are the main goals for this session. Now, before we get started, please tell us about yourself. And we're gonna run, Emily, if you can help me with the poll, we're gonna run this poll about what is your academic role. We're trying to get to know you, get to know who's in the audience, and learn more about you and maybe your challenges and your experience. So if you can take a second to look at the poll question and submit it. We're gonna give it a few seconds. So it looks like, I'm gonna move this maybe to the side. So it looks like we're gonna have assistant professors mostly. We have 6, and then some resident medical student, associate professor, community physician, and other. Okay, very good. So this is perfect. It means that this webinar is going to be perfect for your career, and we are going to work with you to improve your scholarly output. So first things first, why is it important to publish case reports? Well, if you're a resident or you're in a fellowship, you will improve your CV. If you're a student, you will improve your CV. So applying for residency, applying for fellowship improves your CV, improves your chances of getting into your desired place. but also if you're an academic physician. We all know that in academia, when you apply for a job as a physician, you need a good CV with publications. As an assistant professor, associate professor, you have to show productivity. So this is good for all levels. I would say once you get to associate professor, case reports may not be as appreciated as peer-reviewed publications. However, depending on your FTE for research, that may be relevant for you in particular. It's also important to complete your residency and fellowship. A lot of residencies and fellowships require students to at least work on a case report, present a case report, or even publish it. It will help to get promoted as an academic physician. It will help your reputation in professional community. If you're known as a person who doesn't only treat individual patients, but will like to share their knowledge and experience with the professional community. And of course, improvement in medical education. But most importantly, it leads to improvement in patient care. And that's what I wanted to convey to you today. It's, scholarly output for case reports is important, but it gives us practicing physicians what we need to know to take care of that unusual case or unusual presentation. So it's important to do our best efforts to publish things that are worth publishing. So again, before we go on the how do we write a case report, we're going to want to write another poll. And the poll is, have you ever written a case report? We're trying to get to know how familiar you are with the topic and how detailed or more general we should be. So you see here the choices. I have either published a case report, I have submitted a case report, but it was not accepted yet. I have written a case report, or I have collaborated on a case report writing project. So choose the one that you're highest. So if you did publish a case report, then that's what you should be. And by case report, we mean a clinical case. Okay, very good. So we have some who have published a case report already, or who have written case report, and some of you have collaborated on a case report. I guess more of you have collaborated on a case report. Okay, so this is perfect to start you with writing your own case report. I just want to remind you that you can use the Q&A portion, which is kind of, for me, it's on the top of the screen, but there is a Q&A portion where you can click and add your questions. And my panelists will be happy to let me know, and we'll answer them as needed. I am very happy to answer questions during the presentation. So if it's something that you're thinking about, please go ahead and put your questions in. Okay, so how are we going to get started? First of all, get familiar with the writing process before you write the case. I know I have some mostly students that are writing with me, and some even residents, and they start writing things, and then when we talk about, okay, this is how you write the case report, then they get, oh, I wish I would have known this because I've done a lot of work on this. So get familiar with this, and this is a perfect opportunity, this webinar, to get familiar. And then anytime you encounter a case that puzzled you or puzzled your team, think about reporting the case. Okay, it doesn't have to be all difficult cases, and we'll talk about what kind of cases, but try and get any opportunity to think about, is this an important case to report? Find a more experienced mentor or collaborating willing to co-author the case report with you. Especially as a first-time writer, we would suggest that. I know some of you have already written case reports, so maybe not relevant for you right now, but for those of you who want a more experienced person to write with in the beginning, you can do that. Make sure the other person, the mentor, the collaborator, agrees with your expectations, agrees with your deadline. There's a lot of tension that you don't need to have regarding expectations and deadlines. If your mentor, let's say you have a case, you're family medicine, and you have a case that's something with cardiology pathology, and you go to a cardiologist and say, hey, do you want to write this case with me? And they say, no, it's not worth it. I would encourage you to ask why. Because it may be that in particular in cardiology, that's not very, that's not really relevant, because maybe it's a more common case, but maybe the way that you approach it as a family medicine physician is relevant. So I would encourage you, don't give up without an objective reason. Look up for what was reported before and try and ask yourself, why can I make this happen? If you cannot make it happen, not all the cases are going to be relevant. So some of them you may not make it happen, but some of them you may. And those, I encourage you to kind of keep pursuing those. And set your deadline, make it happen. I know all of us, students, residents, physicians, we're all very busy. And we all have a lot of deadlines. But if you want to increase your publication record, if you want to contribute to the science, if you want to contribute to the profession, I would say you find something you want to report, set your deadline, make it happen. It doesn't take a long time once you do it once. So get familiar and then it gets easier. So how do you select a case report, right? It's a case that you want to share with others. And I would say it's either a new or rare or an unusual condition. It's either a rare or unusual presentation of a common condition. It's a condition that needs to have increased awareness, right? So it doesn't have to be new, but it may be that you need to increase awareness. It may be a novel therapeutic regimen. It may be a more cost-effective diagnosis or management, maybe a rare or unusual complication of diagnosis and treatment, or maybe a challenging diagnosis. And I think one of the questions that I got in the chat are relevant for what we're talking about this now, is what do you do if you do not have anyone to mentor or collaborate with on a case report? Is this something you can do on your own for the first time? I think you can do on your own, but I would strongly suggest that you work with someone. And I would strongly suggest that you attend our workshop, which is going to be sometime soon. I'm going to let you know in the last slides. Because truly, as a first publication, just like any other publication, first publication, it's usually important to have someone who you work with. And if someone doesn't want to be your co-author, that's fine, but at least they could mentor you. Or you can just email us and we'll help you out. Okay, so before you start writing, things to do before you start writing a case report. First thing, obtain patient consent and IRB approval. And we're going to talk about this in the next few slides. Then you need to use primary literature to find out what else has been reported about this condition or this treatment. And I mentioned this maybe even before going to your mentor. You should go ahead and read, do a PubMed search or a Cochrane review and see, is this truly new? Or there have been tons of cases reported like this and it's all known, right? So do your job, do your primary literature search. Define your outline, right? So look at your case, make sure you know what has happened and in what order, and think about, why would I want to report this case? What are the teaching points? What is the take-home messages? How would my professional peers benefit from this? So let's talk about patient consent for publishing the case. Some journals have their own form, but not all of them. Some hospitals have their own form and approval process. So get familiar with the hospital or the clinic you work at. Some hospitals or clinic have kind of an embedded form, like boilerplate consent. When patient consent for treatment, they also consent for publishing their case. However, that is not sufficient for the journals. They want you to have their own form with the patient's signature. So I would encourage you, before you start writing, before you're making all this effort, make sure that the patient is consenting to you reporting their case. Make sure you have the journal that you're going to submit to, the special form. Make sure your hospital, you're going with your approval process in the hospital. I had students who did not follow the approval process of a hospital they were working at, and that didn't turn out very well because it was a different process than different hospitals they were at. And then know that some hospitals and some journals accept a generic form. So just get familiar with what's around you and what you need to do. I have here an example for a generic form for medical photographs. A lot of family medicine cases are going to be with photographs. So this is just adapted from American College of Medical Genetics, and it's a statement from 2000. I thought it was very good. It was comprehensive, and it's an example. Again, some journals may have their own form, so it's not necessarily sufficient. Now, have you ever submitted an IRB protocol? I was going to talk about IRBs and approval. So we're going to run this as a doodle poll. Not doodle poll, as a poll. So have you ever submitted an IRB protocol? It doesn't have to be for a case report, for anything. Go ahead and click yes or no. We're going to give you a few seconds here. Okay. So we have yes, half of you, no, half of you. Okay. So that's good. That's good. So some of you have experience with IRB. It's really good. It's always a painful process. So if it hasn't been painful for you, you are a lucky person. What I want to tell you about IRB approval for case reports, and many universities, not all, but many, single case report, meaning just one case report that does not contain patient identifiers and meets the following criteria is non-human research, okay? Which means that some universities would say you don't even need to submit an IRB approval form. But some universities would say, even though it's a non-human research, you need to submit a form. So for my university, for example, they don't need, for one single case report, they don't need any form submission, as long as I do have, you know, this criteria. So what I have done for myself, just because I want to make sure it's all good before I work on a publication, I send an email to IRB and I say, okay, my study report contains information from one patient only, does not contain patient name or initial, does not contain patient birth date of birth. So all of these things, I let them know, and they send an email back saying, okay, you're fine, right? But some universities, know that for sure, they require a form submitted. So get familiar with what's your university requirement, and of course, follow those guidelines. I want to make a note on case series. So case series is a little bit different, means that you have, let's say, 3 or 4 cases that you want to report. And for those, most universities require IRB approval. So right now we're talking about a single case report. Before we dive in on how to write a case report, are there any questions or anything that you were thinking of before we move forward?
There's nothing in the chat right now, but please continue to ask questions along the way.
Very good. So how do you write a case report? The usual depends on the journal. However, the usual components are this: the title, the abstract, the introduction, case presentation, discussion, conclusion, references, and acknowledgement. So if you have kind of all of this written out, you can modify it for any journal that you may want to submit to. And I see there is a question. So the question is that if you don't have any of those things listed on IRB, such as, so I guess these things, all the patient identifiers, do you need patient consent prior to writing the case? I would say yes. The reason is a lot of journals would require you to submit a patient consent, even though it's one case. Okay, so you may do all the work. You're done with IRB, you're fine, you write a report, you submit it. I know some of my colleagues who have submitted, they got feedback, it got approved, and then they said, oh, I'm sorry, you forgot to upload your patient consent. And they said, well, my university has like a boilerplate consent. And they said, no, you need our particular patient consent. And they contacted the patient and they said, oh, this is what it is. Can you sign this for us? And the patient said, no, I don't think so. The patient says, no, it doesn't matter that previously on the boilerplate, they said, yes, you cannot publish it. So I would say for the person who's asking the question, yes, it's important to get the consent because you don't want to do the work for nothing. Does it make sense? I don't know if you want to, did I answer the question that you asked? Yes, okay, so yes, thank you. Okay, sounds good. So these are the usual components. Very good question, by the way. I appreciate it. So, okay, so these are the components, but what I recommend you to do is don't start with in this order. So try and use a different order that makes sense to me, and I think it's easier to write. So start with a case presentation. You describe the events in chronological order. And what's important, right? For review of system, include only the pertinent negatives, okay? So you need to save your space. Use as much objective data as possible. If you have any lab results, include them. If you have de-identified pictures of imagistic studies or pathology reports, CT scan, an MRI, all of these. Include your vitals, everything for objective data, okay? That will help your colleagues to get a better picture of the case. It's kind of like when you present your case in the morning report or you ask a consult, okay? Avoid abbreviations. Just read everything in medicine, avoid abbreviations. So that's your case presentation. That's the first thing you do. When you write your case report, make sure you don't include this identifiable information. And this is from hhs.gov, this list. So names, geographic division smaller than a state. So some of this may not make sense to you right now, but all of this, all elements of dates except the year you can do, but you cannot do month or day. Of course, telephone numbers, fax numbers, social security, medical record, device identifiers, internet protocol, biometric, full face photographic images. You cannot do that, right? So you have to cover to de-identify the person. You have to cover the eyes, okay? Any unique identifying number or code that might identify an individual, we can do that. So when you write a case report, make sure you have all of this in order. Okay, so what about the discussion? Focus about why is your case important? And why is your case significant? And why is your case different than other cases in the literature? So what I would do when you looked up your cases, when you did your literature search before starting to write a case, you have some cases or you have some literature that you already have set aside. So compare and contrast other similar cases or the literature that you have obtained or the guidelines, whatever it was important for you in the literature search, with what you have right now, what you are presenting right now. So compare your case report with what's already in the literature. However, one big thing to remember, this is not a comprehensive literature review. I get a lot of case reports who are like one full page, 500 words of a review of, I don't know, what's known about hypothyroidism. That's not meant to be that, right? This is meant to be, how is your case different than what's usual in the literature? So focus on the differences and similarities. And then you write an introduction, which is weird because the introduction is the first part, but this is the easiest way to know. So after you figure out what's your case, what's your discussion, what are your points, now think about orienting your reader and providing a brief background. So what is already known? So of course you're pulling back the articles from the discussion. What is unknown, right? Why is this case reported? Do you want to increase awareness of certain disease? Is it rare? Is it important because students usually miss this particular diagnosis? How does it impact the physicians? Does it impact the teaching physician? Does it impact the practicing physician? Does it impact the management of the disease? So look at all these things and try and make a point in the introduction. Again, not a complete literature review. Conclusion. Conclusion is the easiest one to write. So take home messages, teaching points, the impact of the field, and it's always good to write a suggestion direction for the future. So if you think about, and that's something that you do need to talk to some of your colleagues. Okay, so I'm reporting this case. What do you think will mean for the future? Or how would we change this for the future? Should we change guidelines? Should we make more patient education material on a certain topic? Should we advertise more about this disease and the signs or the symptoms of this disease? Should we have more CME talks on this topic? Whatever it is. So think about if you can give the readers an idea of what they should do for the future, that's always a higher importance, higher significance case. Next point, references. Primary literature only. And when I say that, I'm talking about usually no reviews, right? So we want to talk about primary literature. We want to look at the base of the literature. You can have guidelines still. Use most recent publications, and it depends on the case. So I know I have accepted a case that had 3 references from like, I don't know, 20 years ago. And first I thought, wait a minute, 20 years ago? That's too long. So, in the past 5 years is the best. The reality is that there were no other cases except those one published 20 years ago. So most recent publication as you can, and make sure you put in your discussion that has nothing been published since then, so we all know when we read your publication. Usually 5 to 10 original articles are about what most journals are requiring or are necessary. The abstract is a concise summary of your case. I would say, kind of one sentence from each section. And the title, the disease name, the population, why is this important? It's good for case reports, usually to have a catchy title, like something that will catch people's attention. And I admit I'm not very good at that, but I know a lot of my students are really, really good at that, and residents. So sometimes I tell them about it and they come up with something really fun. Just because with case reports, it's good to catch people's attentions like this. Before we go further, are there any questions about writing sections of the case report? Anything that may have not been clear?
Dr. Pasarica, I wondered if you could share with us your thoughts about, if I'm thinking about picking a case, can I pick something that was really complicated and challenged the team, or should this been an example of something rare or impactful, but we really nailed it? We got it. We figured it out along the way.
So yes, a rare thing is always important. It's always publishable, right? But can it be something that puzzled the team? Yes, but you have to have a reason for puzzling the team, right? So the puzzle the team, it wasn't because we didn't do our job correctly. The puzzle the team was maybe because it was a very complex case, or it presented in an atypical way, right? So that's why it puzzled the team. Or maybe because we don't usually have this in primary care. Does it make sense, Tyson?
It does, and I have 2 additional questions for you from the audience. Number 1, can you use review articles such as those from AAFP for background info of the case?
So I would say and then I think the second one is what is meant by primary literature. So they both of them go together. So I'm going to try and answer both. So primary literature, I would say, so let's say you get an atypical presentation of hypothyroidism is your case, right? So what would I cite for that? I would look for maybe a guideline from the Endocrinology Society on hypothyroidism, on the diagnosis and management. So I would probably cite that. Or you can have an AAP guideline on hypothyroidism. But then I would go, okay, are there any cases reported with this particular presentation that I'm saying, with like maybe someone had a stroke and they had hypothyroidism, and there was the presentation for the hypothyroidism, right? So are there any cases in the literature? And I would try and look for those cases in the literature. So it would be a case report here, or maybe serious cases here. But I wouldn't cite a review paper in which they say, usually hypothyroidism presents with this for, with weakness for 50% of the time, hair falling for 30% of the time, and you can say that stroke was never mentioned. Okay, so rather than doing that, rather than citing a review article, go to the literature and say, are there any case reports or case series mentioning this particular presentation? Does it make sense? Because you always get more information like this, rather than a review may not consider it important. Okay, so it looks like it was clear enough. Okay, sounds good. Very good question. So we're trying to get, so that's another poll question. Which parts of writing the case report seems to be more difficult for you? We're just trying to gauge your opinion and kind of where maybe we may need to give you additional help or additional support. So if you can go ahead and enter your answers in the poll. I think Emily's gonna post the poll question. It's just a few seconds. There you go. So which one would be more difficult for you? So the abstract, and I think if it's multiple choice, you can choose more than one, but it will give us an idea of where do we need to spend more time next time, or maybe this time. We'll have a couple of seconds. Okay. The results are, so most people think they're more difficult, the methods and the discussion. Okay. Okay, the discussion, I definitely agree. I think it's very difficult, but then it's kind of spread all around. So I would say for the workshop, we're probably gonna spend significant time on each of these, but we'll be happy to help you, and we'll give you information in just a few slides. So this is kind of the answer to a frequently asked question. that I get usually when I talk about case report, about presentation and submission guidelines. So if you write a case report, but you never presented or submitted, it's kind of like you never wrote it. It's kind of like with the patient. If you didn't document it, you never advise them on the side effects, right? If you didn't put in your chart. So what I would say, especially for students and residents, you can submit, but also for assistant professors, you can submit the case report to a conference of your choice. There are a lot of conferences that actually do accept case reports. You are more likely to benefit from that, from networking, right? You're going to have people come and get your poster. They're going to give you some feedback. Maybe for those of you who are students or residents, help you for your next application in your career. And then it will look good on your CV. Even a presentation will look very good. You don't need to publish it. You can have a presentation. Usually those are poster presentations. So I would strongly suggest when you write a case report, submit it to a conference of your choice first. Then submit it to the journal of your choice. It's very important that you cannot submit it to a journal and then to a conference. I get this question all the time. Because the journal, when you submit your work to a journal, they retain the copyright. Okay, so you cannot submit it for presentation to a conference because they have the copyright. And also most conferences will say, acknowledge that you have not submitted this somewhere else. However, when you submit a paper for or a case report for publication, it's okay if you've presented before, not if you publish it, but it's okay you have presented. So after you write a case report, number one, submit it to a conference of your choice. And number two, find it where you want to submit it as a journal and submit it. When you choose the journal, of course, the highest impact factor and the PubMed index are the most appreciated one. However, depending on where you are in your career, you may be okay to go with the lower impact factor. And usually case reports are not really very high impact factor. So this will be okay. I know for students and residents, even if they're not PubMed indexed, it's still okay. So it still helps your CV. For assistant and associate professor, I would say that if they're not PubMed indexed, they may not do a lot of help for your career. So thinking of your journal of choice. What do you do if it doesn't get accepted? That will happen. If you think you're gonna write something and gonna get accepted and life will be good, it doesn't work like this. Usually for publications, you will get at least one reject, right? But don't give up. This is the important thing. It's not the writing that's important, although significant, but you can't give up, okay? Move down the line, find another journal or find another conference and do it fast. So I put this fast in red because I cannot tell you how important it is to keep the momentum going. Whenever you leave a paper on the side, and I admit that I was guilty of that myself, if I leave a paper on the side, then you have to kind of get again into the, okay, let me remember what I wanted to say with this, reformat it, find another journal. If I have a co-author, what am I gonna do? How am I gonna find a co-author again and contact them? So I would say if your paper gets rejected, go ahead and submit it somewhere else, keep the momentum going. That's, if there's something that you learned from me today, I would say that this would be a big thing to learn. Okay, so I talked about if you publish in a journal, you cannot submit it to a conference. Only submit to one publication at a time. I did get this question for multiple students, not from physicians, but from students. I did get this question who wanted to submit to multiple publications so they make sure it gets published somewhere. It's not allowed, okay? Just one publication, it gets rejected, you do the other one. While the publication is considering your manuscript, you cannot do anything with it. They have the copyright. So please make sure you follow these ethical guidelines. if you are lucky and you get an accept from the editor, but they say, I have some suggested edits, right? Almost 99% of the time you will have suggested edits. Complete them in a timely manner. I would say no more than 1 week. And I'll tell you why. Even if you're busy, sit down with your collaborator, do it as fast as possible. The reason is you are now familiar with the work. It takes you less time to actually do the work, okay? And right now, but in 1 month, you may forget. You may forget what you wrote, and it will be more difficult for you. So I would say no more than 1 week, sit down, send it. It's also good for the editor because what I do as an editor, so I read the article and I say, okay, that's fine, accept, and then the reviewers read it, they give some feedback, and then we send it to the author. And then if the author sits on it for like 2 months, when it comes back to me, I don't remember it either, and the reviewers don't remember, so they read it with fresh eyes. And what happens a lot of time is that they find more things that they want to change. So if you want to do it fast, I think it's efficient and is the best thing to do if possible. Be respectful and agreeable and address all the concerns individually. I cannot tell you how important it is as an editor to read a very organized, respectful response. Thank you for your feedback. It really improved the manuscript. You know, the suggestion number 1, you know, blah, 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 whatever they ask you to do, you know, add a picture of the CT scan. We thank you for this suggestion. And we added a picture on, I don't know, page 5 in whatever, okay? So be very descriptive, or if someone says, please add this in this discussion that this is a limitation of the case report. And you say, okay, well, thank you. We realize, you know, we should have done that. And this is what we added, right? And then in quotation, put what you need to add. You may have spelling mistakes, or you may have mistakes, you know, just small mistakes. And in that case, you say, or you forget to do something, or you didn't spell out like an acronym, and you say, we apologize for the oversight, for you know, for not figuring this out, and we will correct this as needed. So be respectful. This will get you to publish. Ask your mentor to review it and then send it back. So I've worked with a lot of students and residents, and sometimes some of them are very proactive, which is really good. So they do their thing and they submit it. And it may be that some of them are experienced, but most of them are not. So when you're not experienced, get the and all the time, right? All the time you have to get all the authors to agree on the revision, but especially when you're the junior author. But all the time, the authors have to agree on the revision. So remember that. You don't want to make enemies, and you don't want to, again, not be ethical, because that's an ethical issue. Now, remember, with time, your references will not be up to date. Okay, so you may need to search the literature again, because maybe an article was just published, and you need to make sure that your article would be up to date. So that's another good thing to do. I have here some links to already published case reports if you wanted to check some of them. There's no one better one than others, but if you wanted, that would be you know, you can just click on them. And then I want to acknowledge one paper that I've used as inspiration for this presentation. I thought it was very good. It was in Med Portal. And some other useful resources: how to write a patient case report, the care guidelines, consensus-based clinical case report guidelines development, and a library paper that tells you about where to publish your case reports. Looking at the resources, are those legit or not legit? So I think Caesar's asking, what FM journals do you find are good to submit? I think family medicine, if I remember correctly, has case reports. And are case reports considered peer review? Yes, if case reports are published in a peer-reviewed journal, all the publications in a peer-reviewed journal are considered peer-reviewed articles. So, and if you want more resources, this is a really good one. This one and this one gives you a lot. So the first and the last one gives you a lot of choices of journals. My last kind of take-home point is practice makes it perfect, right? So it's you're going to take maybe a longer time in the first time you write it, and then it's going to get easier and easier and easier with time. So do not get discouraged. Ask people for help. We are here to help you. And actually, we are planning a hands-on case report writing workshop with the STFM experts. Some of them are panelists today, and myself, to apply the skills. And I believe this is on Wednesday, March 3rd at 7 p.m. Eastern. I don't know if anybody can confirm that. Maybe Caesar can check the schedule, but I think this is what it is. What we would like you to do is have a small group. We say about 10 participants, so first come, first serve. Please sign up early. Send us your draft or send us your idea, and we will work with you for that particular hour. We're going to have at least 4 or 5 people who are going to work with you individually to make that case report into a publishable case report. And I just got confirmation from our chair of the committee that this is the correct date. I'd like to thank you for your attention, and I'll answer some questions that I see in the chat. But thank you for being here and being here at the very late day after work. We appreciate it. Let's see. So I have a question. How difficult is to publish in the AFP? It's difficult to publish in the family medicine journals, just like it's difficult in any other journal. But what I would say is the higher the impact factor, usually the more difficult it is. And another question is the list of FM journals. I do not have a list of FM journals, but what I have shared with you is here 2 resources, this one and this one, both of them, especially the one on the bottom from a library journal that gives you a list of case reports journals. What I like to say is you have family medicine that you publish, of course, family medicine cases, but do not restrict yourself only to family medicine journals. You can publish in other journals that have a different focus and talk about maybe the interaction between family medicine and cardiology, and this will be a cardiology journal. Or talk about cases, cardiology cases that you see in primary care, or how maybe something rare or something difficult or atypical that it will improve the communication between the two. So there's a lot of this, a lot of options. So I know some of you are wondering which ones are the family medicine. So what we're going to do, you can, of course, I think you have access to the PowerPoint and the talk, so you can Google this later on and look at them. But we're also going to talk about each individual one, or maybe give a little bit more details when we have the workshop.
We also have a question about whether there are any journals that are specific to case reports among minority populations.
I do not know. I know, for example, that there is a journal of underserved population. But I assume there would be a journal with case reports amongst minority population. But I do not know to tell you off the top of my head. No. That's a very good question. And maybe we'll answer that at the workshop. That would be a good workshop discussion. I think there is another question that maybe I'll let Caesar answer. Are there any other opportunities for research mentorship through STFM or other organizations? Caesar, would you want to take that?
Absolutely. So, in terms of STFM, one of the things that we're really doing is promoting scholarship, particularly among those that are underrepresented in family medicine. So, one of the things that our goal is to actually continue this programming. One of the ideas that we're hoping to implement by spring is to have monthly virtual writing labs or retreats where you all, if you have questions, there will be a set of panelists and experts who are able to provide guidance or additional tips and resources for you to progress in your research. So if you're interested, send us an email and we can provide that information to you and we'll support you along the way.
This is not, the only opportunity. So if we see a lot of interest and a lot of people signing up for the workshop, we are happy to provide you with more of those workshops. The group here is very committed to improve your scholarly output. I think there's another question.
There's a question about whether you're aware of any conferences that do accept case reports.
And I was gonna ask if I know for sure that Florida Academy of Family Physician does accept, because I know my students have published over there. I do not know about STFM, and I wonder if maybe Emily would be able to check that, or any of my panelists would be able to check if STFM would allow case reports. I would assume so, but I don't know. Most conferences do accept case reports, but if someone can check for me, I would appreciate it.
So this is Emily Walters with STFM. I might need to look into that. I actually don't know. We have research in progress posters. I have a feeling this might fall under this category. The conference is not my area of expertise, so I don't want to speak out of turn here, but I think that might count. Let me find some info real quick.
There's also suggestion that the New England Journal of Medicine and JAMA have included more in terms of underserved populations. And we have a few more moments for questions, so please, if you're wondering about something else, please send us those questions. And this is another reminder that we'll share the PDF of this webinar via email to all attendees, as well as a recording link tomorrow.
I see one of the one of our participants has said that they present a case report, ACOFP. I don't know what that is.
Annual Convention and Scientific Seminars.
I guess
Is
I think Emily has put a call for presentation. Emily, does it have an? I don't know if I can click on it as I'm presenting. Does it include?
Right. So I think that it does. So I'm looking at it right now. Particularly, there's like scholarly topic roundtable discussions and completed research projects. And it looks to me like it would include like clinical care research or management. So that's why I was trying to like do a quick comparison to what we discussed today. And I believe it would include case reports.
Okay, so that's another opportunity. Osteopathic family practice. It looks like it's another opportunity from one of our participants. And somebody asking a question, what is the, okay, I think it was another question that I didn't answer about.
I see one question about what if a patient is not able to consent, i.e. if they're sedated, intubated, or deceased?
Yes, that's a very good question. Any patient who's not able to consent, they will have a caregiver that will be able to consent on their behalf. Any child would not be able to consent, so the caregiver would have that. If someone is sedated, intubated, someone is making the decisions for them, and that's the person you should get the consent from. If the patient is deceased, you may have needed to get the consent before they passed away, I would say. Hope it makes sense.
Another question about a general timeline for completion. So time you start writing to time it's accepted and published, time you should set aside to get things done in a timely manner.
So that's a really good question. So it depends on you, right? It depends how much time you have. It depends how used you are with reporting. But I would say to write a case report should not take more than a day. But it will take you maybe longer to contact the patient and get approval to figure out if you need IRB consent and all of those. So I would say that as you go now back to your work tomorrow, try and figure those things out. How is my IRB? What does my IRB needs me to do? And what is my institution needs me to do? And what is the consent form for a particular journal that I think I want to publish in? So then, take a day, and I think you're probably done. I would say so, but it may take longer depending on your comfort. Thank you. One of our participants, Linda's, give us compliments. We appreciate it. We hope, I think it's only 2 more minutes until the time is up. So I want to thank you all again for your participation, your questions, the time spent with us, and we're looking forward to see you at the workshop on March 3rd. Unless there are more questions, we're still here. Okay.
Nicely done. We thank you so much, and please consider joining us on March 3rd. I put in my email, and if you send me an email, I will add you to our information list that we send out when we hold these different events. Also, we regularly hold Twitter chats and webinars such as this, and then we're going to start up the monthly writing lab and support. So please join us, and thank you for joining our webinar.